about 2010, I bought a really small practice that had, it was an older dentist, had a lot of older patients, and hadn't been growing for several years. So I knew I needed to make a change in order to kind of jumpstart my new practice and set things up the way that I wanted it to be. So I began using the marketing tools that they provided at the time and really started to grow the practice within about 6 months' time. We started to see significant improvement in new patient flow every month just to start building and growing. But we began mailing just flyers every month using the standard flyers that they helped us to produce, customized flyers for our practice, and sending them out to targeted areas, targeted families, targeted income demographics and family demographics, kind of trying to attract the patients that we wanted to see in our practice. And that worked for a really long time. That was about all we did initially for the first few years. And then as digital media and things really started to progress, we got into that side of it as well. So website, video marketing, Google AdWords, those sorts of things to add more variety to the marketing types. We are consistent with the number of phone calls that we have. So now we use our marketing tracking lines. So phone lines that are specific, mailers go out with a specific phone number on them. So we're able to track the phone calls, record the phone calls, listen to the phone calls with our team members, review some of the things that we need to go over, talk about what went well, maybe what didn't go so well on that patient. But we can also track our return on investment. So it makes sense that, with our review calls that we have with the marketing team, we can talk about, okay, this is how well your mailers are performing, or this is how well Google AdWords are performing, or this is how long things are lasting. So it helps us to really focus on the specific types of patients that we want to see. Everything evolves. My practice has evolved over the years. So initially it was general dentistry, family practice sort of things. As I've expanded my skills and abilities, we really focus on a lot of IV sedation cases, implant cases, reconstructive cases, where we're doing more complex, comprehensive dentistry for a single patient in a big, long session or several sessions, depending on what we're doing. So we have now multiple targeted websites. So we've got our main office website, but we also have a site that focuses on IV sedation, dental implants, and actually reconstructive or even a denture website. As the practice has grown over the years, we were able to build a new office. I've got a state-of-the-art building now with the need to expand again almost because we're bursting at the seams now. It's been about 6 years since we built the initial building that I built back in 2016 that we moved into. And again, it's growing rapidly. So now we're ready to consider expanding again soon, but it's allowed me to hire an associate dentist now. So we're continuing to grow to be able to manage and help those patients. In our community though, I think it's really helped to establish us as a premier community. It's a relatively small community, about 25,000 people in our actual town. So we've established ourselves as the premier cosmetic and implant office to head to. And so it allows me really especially to focus on those things that I like to do, the productive things that help to really make income happen for our practice. The things that excite me though is that I can do these things and it helps my team members as well. So we've got a system set up so that my team, when we do better as an office, the team members make more money as well. And so it's fun to see them able to buy new houses or get their kids cars and be able to afford those things that, just a regular dental office making an hourly wage may not be able to totally afford. They actually get really nice bonuses based on what we've done. So it helps them in their personal lives as well.